Bulabinaka, Fiji. This evening I wish to discuss with you how we are now seeing important shifts in the COVID-19 situation in Fiji. Today we have 205 new cases of COVID-19 to confirm. It is not the total number of cases, but the location of these cases that is of greatest concern to us. We are now managing outbreaks in multiple locations across Fiji, including in some of our remote areas with limited healthcare infrastructure. As you no doubt aware, the virus has now spread out of Vitilevu to Kandavu, Malolo Island, and Naviti Island in the Sawa group. We have confirmed 29 new cases in Kandavu, adding to a total of 164 active cases reported on the island. There remain 23 active cases reported in Malolo Island, and investigations and further testing of contacts are continuing. We have dispatched a 55-member response team to Kandavu this week to assist with containment efforts on the island and to offer treatment for those who develop severe disease. In response to the situation in Malolo Island, we have deployed a public health team to rapidly map out a plan to contain the virus and also identify community members who are at most risk of severe disease. To ensure we are allocating our health resources best, we are requesting that all operations in Vudimbaka are put on a stop immediately. For Somosomo village in Naviti, we expect the impact to be more severe. As you previously probably have noted from our previous statements, in Somosomo, the first evidence of the disease being in Somosomo was the death of a patient. And in that instance, that is similar to the situation that we got in Kandavu, which means that the disease was present for some time in Somosomo before this person had got presented with severe illness. Over the weekend, we will be deploying a team to Naviti to develop a plan to increase our capacity to provide critical care to patients, as well as to put in place protective measures for those who are most vulnerable. Unfortunately, our investigations and deployment to Kandavu, Malolo, and Naviti have been delayed due to bad weather conditions. However, over the coming days, we hope to see quick measures being placed in these new areas of concern. As regards to the Northern Division response, the response to the cases reported today in the Northern Division, the Namaratiri settlement had been placed into lockdown, and checkpoints had been set up in 2 road entry points into the settlement. The Nambawalu index case, that is the first Lambasa case that we confirmed, is in stable condition, and the members of their family have continued to test negative for the virus. All primary contact exit swabs have also been returned negative. As regards the 3 cases in Namaratiri Lambasa, as far as so far, we have established 60 primary contacts. All swabbed and have returned a negative result. However, we're still having ongoing investigations to verify the final number of contacts that we need to get in touch with. Screening teams are sweeping the containment zone today, and this is outside the Namaratiri area. They have collected another 84 total swabs, and they'll continue to swab and screen at vaccination sites in all the other health stations in Lambasa area. Most of the families in the Namaratiri lockdown area are low-income earners, and we know that they will be heavily impacted by this lockdown. This is why we will be providing essential food and supplies to households in the lockdown area, with our teams making sure that COVID-safe measures are put in place when delivering these items. Our contact tracing teams have identified the places where the second COVID-19 case went, and because of this, we will be placing a restricted movement for the greater Lambasa town area. The reason for this is to reduce the risk of the virus spreading out of this area, as well as to allow time for our health teams to undertake screening in the local population. Under the restricted movement, the following measures will apply to the Greater Lambasa town area from today. Curfew will be from 8 p.m. to 4 a.m. If more cases are detected, these hours might change. Until further notice, all persons in the public places in the provinces of Mbua and Maduata must wear a face covering except with a reasonable excuse. Children under 5 may be exempt from this requirement. The following essential businesses can remain open but must apply strict COVID-19 protocols. Supermarkets and shops selling food, banks, pharmacies, and FNPF. Restaurants are only open for delivery and takeaway services, no in-person dining. Other businesses such as factories and shops can open, but they must follow the following measures. Vendors and business must ensure strict physical distancing. Customers in queues must be spaced 2 meters apart and no crowding. Customer-facing businesses must limit customer capacity to 50%. Businesses that do not manage these risks with COVID-safe measures will be shut down. Within the Lambasa town area, high-risk businesses such as gyms, movie theaters, video gaming shops, cyber cafes, taverns, bars, billiard shops, and amusement arcades cannot open for at least the next 14 days. We know that when applied and followed by the public, these strict containment measures are successful in reducing the spread and allow our health teams to identify and isolate people who may have been infected with the virus. In the north, this will also buy us precious time to allow our vaccination team to reach all eligible adults for vaccination, in particular those who are at risk of severe disease. We are also strengthening our network of northern screening clinics, and we encourage anyone who has COVID-19 symptoms to visit one immediately. We request if people who have these symptoms do not go to their normal health center, as this puts other individuals in that health center at risk. They need to go to the screening clinics. COVID-19 deaths. We have 11 COVID deaths to report today. And I'll just go over some important points that these cases have come up with. Of significance is that 3 were fully vaccinated individuals who had existing medical conditions that placed them at higher risk of severe disease. I know that some of you have heard that the recent claims made by certain members of the community that the vaccines don't work. But I want to start by reminding you that COVID-19 vaccines provide a person the best protection from becoming seriously ill, hospitalized, or dying from COVID-19. Global studies and what we learn from other countries like the UK show us how effective these vaccines are in reducing the number of persons who are seriously ill, hospitalized, or dying from COVID-19 by providing the person up to 92% protection. However, like any other vaccine, there is a small chance that people who have been partially or fully vaccinated can still get infected with COVID-19. And sadly, fully vaccinated people can still get COVID-19 and die, because 92% is not 100%. No vaccine offers 100% protection. Because the effectiveness of vaccines depend on the individual's immune response, the risk of death in a fully vaccinated individual increases if someone has a medical condition that weakens their immune system, like diabetes, heart disease, chronic kidney disease, obesity, or they are in an older age group. These deaths in fully vaccinated individuals are rare. However, we expect to see these as we continue to see widespread transmission in our community. I want to reiterate that they are rare. But when something is rare, if there's too much of the infection happening around in the community, that rare event as an absolute number will become plenty. So 0.3% of 100 is not even 1, but 0.3% of 1,000 infections, that will come to 3. 10,000 infections, it will come to 30. 100,000 infections, it will come to 300. So the more the amount of infections that are spreading around the community, the more we delve in we do not apply our COVID-safe measures, the more likely there's plenty infections around, the bigger the number that we're going to see in terms of this rare event. So I just want to reiterate that the evidence is very clear that vaccines will lower your risk of severe disease and death if you get infected with COVID-19. Of the 477 deaths recorded in Fiji during this outbreak, 371, that's 77.8%, were not vaccinated. 103 were partially vaccinated. And 3, which I've just mentioned, were fully vaccinated. Therefore, 99.4% of people who have died due to COVID-19 in Fiji were not fully vaccinated. Also, of the 11 deaths reported today, 2 are children. These losses show us a new picture of how the virus is impacting our community. The death of a child is always terrible, and sadly, COVID-19 does not discriminate. Whilst we know children are at significantly lower risk of suffering severe COVID-19, unfortunately, as we continue to see the virus spread in our community, we will see children being infected and some tragically dying from COVID-19. So once again, we are set with the same example. A rare event is rare, but if there's too much of that event happening around the place, then those rare events will become commonly seen. It is very rare to see infection in children, but if there's too much infection around the place, more children will definitely be seen to get sick, and more children will be at risk of dying. This is why I cannot reinforce enough why COVID-19 vaccines are critically important, and we must all continue to practice other COVID-19 safety measures if we want to see a drop in COVID-19 cases in our community. Again, I want to reinforce this message. COVID-19 vaccines are critically important, but at the same time, we must all continue to practice other COVID-19 safety measures if we want to see a drop in COVID-19 cases in our community. This means wearing a mask properly, keeping physical distance from others outside of our household, washing our hands regularly and avoiding crowds. Without these measures, plus high levels of vaccination coverage, we can expect to see COVID-19 continue to spread in our communities and find those who are most vulnerable. Due to the combination of steady vaccine administration and the adoption of COVID-safe measures in the Central Division, we are happy to report that we are seeing a reduction in the number of individuals being treated in hospitals and dying. Unfortunately, the situation in the Western Division is getting worse as we are seeing an intensifying outbreak. The containment area protocol in the Central Division had prevented a concurrent rise in hospitalization and deaths in both divisions. And for that we are thankful, because that would have complicated our medical response. Because we have delayed the onset of the peak in the Western Division, it is now allowing us to mobilize our resources away from the Central Division and move towards the areas that are having outbreaks. In regards to some key messages that I wanted to, some reminders about early treatment being the best chance of recovery. I have said before, and again I want to remind people of how vital early treatment is to saving lives from COVID-19. We're still seeing a worrying trend of very severe cases showing up late at the hospital and sadly passing away before we can provide any life-saving treatment. 78% of COVID-19 deaths during this outbreak occurred at home or on the way to hospital or within 2 days of admission to hospital, giving us little or no opportunity for our clinical teams to provide potentially life-saving treatment. As we know that many of these people have been trying to treat themselves at home with herbal medicine and steam baths. While this treatment might help to alleviate some of the symptoms, they should not be the replacement for the treatment at the hospital. COVID-19 is not like the common flu. It is a virus that our body has no immunity to protect ourselves against unless you are vaccinated. For people who have severe COVID-19, for the majority, the key to their recovery will be placing them on oxygen therapy and a ventilator, as well as giving them some of the specific medications. There are many other interventions apart from oxygen, but oxygen therapy is the key. Apart from that, we have things like dexamethasone. Sometimes we give proper IV fluids to make sure the person is well hydrated. We also put them in special positions, prone positions that allow the oxygen to enter their lungs better and allow them to give more time for the lungs to get healed up and for the patient to recover. But all that can only happen if the person comes in early enough for them to be instituted. For many of the individuals who died, there was a real chance that we may have been able to save them if only our health team was able to see them earlier. So if you have flu-like symptoms like difficulty breathing, if you have severe flu-like symptoms like difficulty breathing or chest pain, you need to call 165 now. If someone in your home has severe flu-like symptoms, you need to call 165 now. Do not wait. These symptoms may not go away on their own, and by the time you call, it could be too late. An internal audit of deaths during this crisis indicates that much of the adverse health-seeking behavior that predated this crisis have been potentiated by the misinformation and falsehoods promoted on social and mainstream media. It is even more unfortunate that people from the medical community have promoted this deadly misinformation, doing so in utter violation of the duty of care that we owe to the people of Fiji. When we see instances of misinformation, we gather facts and we try to respond as quickly as possible. But the unfortunate reality about inflammatory misinformation is that it can spread far faster than the truth. To help us combat falsehoods and to save lives, we are seeking communal support to help to identify persons vulnerable to severe COVID-19 and preemptively engage them to have a plan that allows them to identify the danger signs and symptoms early, and then that same plan that allows them to access care quickly. That is the most important part that the community can play in this current crisis in order to save lives. Make sure your grandmother, your elderly person, your father who's got a heart disease, or your father who's got diabetes, or your mom who's got some other comorbidities, watch them carefully. When you see the danger signs, you also should tell everybody around them what the danger signs are. They see the danger signs, they come through one small protocol that you develop at home. You say, see the danger sign, call 165. See the danger sign, call this person, get them to drive them straight to one certain place, get them to see the care they need. But make that plan preemptively. Don't try to search for the plan when in the middle of a crisis. In terms of our vaccination, as of the 26th of August, 230 adults in Fiji have received their first dose of the vaccine. And 255,864 have received their second doses. That means that 94.6% of our target population have received at least one dose of the vaccine, and 43.6% are now fully vaccinated nationwide. Over the coming weeks, we will be going into communities, especially those with low vaccination coverage, and trying to reach out to those unvaccinated. We are also tracking any reports of side effects experienced after vaccination, otherwise known as adverse events. To date, we have recorded 56 reports. And of these, 51 were not serious, and the usual side effects experienced after a person is vaccinated. In addition, we conducted thorough investigation into 5 potential adverse events that we felt were very significant. And following these investigation, we determined that none of them were a result of the vaccine. These investigations were carried out by our specialist medical team in consultant with our specialists in Australia and that of the World Health Organization. Now, I want to talk about quarantine facilities because I know that there are some people now beginning to talk, thinking about international travel and how are we going to protect ourselves from variants. I especially want to speak on some of the recent concerns raised about our quarantine facilities. Lapses in quarantine protocol present a risk globally during this pandemic. We have seen that most of the other countries, even more countries that have a better system than us, have had lapses in their quarantine protocol. I have a specific team led by Dr. Sam Fullman, who together with a smaller military and police team will provide the leadership needed to strengthen our quarantine operations. A border health protection facility has been established in the KEF compound in Namakanandi. And this facility will be responsible for coordinating and overseeing quarantine operations. We are also setting up a container laboratory in Namaka, which has the capacity to process around 500 tests per day. As part of the additional measures to strengthen our quarantine operations, we will also be enforcing the following measures. We are establishing a slot management system with Fiji Airways, so we can put a cap on the quarantine capacity to be always within manageable levels. We are going to restrict international traveler entry to only fully vaccinated individuals, of course, except in some emergency situations. We will be having the requirement that all quarantine personnel engaged in quarantine operations must be fully vaccinated. And also, we've increased the amount of CCTV support and oversight within all our quarantine facilities. As part of these measures, we also want to create a no-blame environment where our quarantine teams will feel safe from discrimination for reporting any breaches or feeling unwell. And this is part of probably the most critical part of this operation is setting up this type of environment, a no-blame culture. At the end of the day, we can only work with lessons learned and we can only improve. History has taught us many lessons, but the scale up that is required on this crisis has been phenomenal. So the only option we got is to continue to adapt and learn as we respond. Finally, I just want to discuss some issues around the Care Fiji app that keeps on coming up. We are receiving some inquiries on the usefulness of the Care Fiji app. On Vitilevu, we are employing a mitigation strategy that does not rely heavily on contact tracing. But the Care Fiji app is still vital because we need to develop a habit of keeping the application turned on whenever we leave our homes. The reason being that COVID containment and contact tracing will become part of our lives for the foreseeable future. We will have the mitigation plan is going as it's going now. Eventually, the mitigation plan will transition to containment again, because this virus is not going to go away. The studies have demonstrated quite clearly that this virus is not going to go away as easily as everybody thought initially. It's going to be with us for a long time. What we need to do is to be vaccinated, practice all the COVID-safe measures, and we can endure until the human body is able to learn how to deal with the virus. From all the lessons learned by other countries around the world, who have high vaccination rates, we cannot relax our game, even if we have high vaccination rates in Fiji. The protection offered by the vaccine is most effective when paired with containment protocols, including strong contact tracing regimes that include the Care Fiji app. Especially in the North and the Out Islands, where we are still aggressively doing contact tracing, our Care Fiji app is still very useful. It will save your life. Also, it will save the life of someone you love, both now and into the future. Thank you.
Thank you. As mentioned by the Permanent Secretary, we have 205 new cases of COVID-19 to report for the 24-hour period that ended at 8 a.m. today. 95 of these cases are from the Western Division, 80 cases are from the Central Division, 29 cases are from the Eastern Division, and 1 case is from the Northern Division. Of the Eastern Division cases, all of them are from Kandavu. So these are 29 individuals who have tested positive in Kandavu, which means there are now 164 active cases reported from Kandavu. In the Northern Division, 1 individual repatriating from Suva to the Northern Division has tested positive while undergoing 14 days of quarantine at the Malau quarantine facility in Lambasa. So this means there are now 5 active cases in the Northern Division. 1 is the original case from Nambawalu, who was a wharf worker, and 3 other cases in Lambasa from the same family. And then, of course, 1 who's been announced tonight as the case from the Malau quarantine facility. The primary contacts of the Nambawalu index case, the wharf worker, continue to return negative results while in quarantine. And 62 primary case contacts of the 3 cases in Lambasa have tested negative. And this is in the Namaratiri settlement. There remain 23 active cases on Malolo Island, but the investigations continue as well as further contact tracing and testing. There have been 151 new recoveries since the last update, which means there are now 19,311 active cases. 9,505 active cases are in the Central Division, 9,637 active cases are in the Western Division, 5 active cases in the Northern Division, in Nambawalu and Maduwata, and 164 active cases are in the Eastern Division, all in Kandavu. There have now been 45,303 cases during the outbreak that started in April of 2021. And we've recorded a total of 45,373 cases in Fiji since our first case was recorded in March last year. And there have been 25,289 recoveries. As mentioned by the Permanent Secretary, we have 11 new deaths to report tonight for the period of the 18th to the 26th of August. 3 deaths were recorded from the Central Division and 8 deaths were reported from the Western Division. As mentioned, very sadly, 2 of these deaths were children. The first is an 11-year-old child from Nambotini village in Navua. She was pronounced dead on arrival by the attending medical officer at the Navua hospital on the 19th of August. She was swabbed and tested positive for COVID-19. She had a history of fever and cough at least 2 days before she presented to Navua hospital. She was not vaccinated. Obviously, she was not in the target population for vaccination and was not eligible to receive the vaccine. The second child was a 6-month-old infant from the Nosori Highlands. He was brought to the Bukuya Health Center by his parents on the 3rd of August and had a 1-day history of fever and irritability. He is noted to be in severe respiratory distress, and he was retrieved by a Nandi Hospital medical team who took him to the Lotoko Divisional Hospital. Sadly, he died 20 days after admission at the Lotoko Hospital. He was not vaccinated as he was not in the target population eligible to receive the vaccine. The next 3 deaths, as mentioned by the Permanent Secretary, the deaths of people who are considered fully vaccinated. So fully vaccinated death means somebody who has received 2 doses of the COVID-19 vaccine and more than 14 days or more has passed since they received the 2nd dose. So there are 3 deaths that we're reporting tonight that were of people who are fully vaccinated. So the first one is a 49-year-old man from Nandi. He presented to the Lotoko Hospital emergency department in respiratory distress on the 8th of August. He had a cough and shortness of breath at least 2 days before he came to hospital. He was tested and tested positive for COVID-19, and he died 10 days after admission. He received his first dose of the vaccine in early May and the second dose of the vaccine on the 9th of July, so he was considered fully vaccinated. The fourth COVID-19 death to report tonight was a 54-year-old man from Ba. He had a history of weakness, loss of appetite, and fever for 3 days. He was admitted to the Lotoka Hospital in respiratory distress on the 20th of August, and he tested positive for COVID-19. Sadly, he died 1 day after admission on the 21st of August. He received the first dose of the vaccine in May, and he received the second dose of the vaccine on the 27th of July. He was fully vaccinated. The fifth COVID-19 death to report tonight was a 50-year-old woman from Rakiraki. She presented to the Rakiraki Hospital in severe distress on the 21st of August. Her family reported that she had weakness, cough, and shortness of breath at least 3 days before she came to hospital. She tested positive for COVID-19 and sadly died on the same day at the hospital. She received the first dose of the vaccine in mid-April, and she received the second dose of the vaccine on the 24th of June, so she was considered fully vaccinated. The sixth death to report tonight is a 43-year-old woman from Tailebu who died at home on the 26th of August. She received the first dose of the vaccine in early July. She did not receive the second dose of the vaccine. This means she was not fully vaccinated. The seventh COVID-19 death to report tonight is a 68-year-old man from Lotoka who died at home on the 26th of August. He was not vaccinated. The eighth COVID-19 death to report is a 78-year-old man from Tavua who died at home on the 24th of August, and he was not vaccinated. The ninth COVID-19 death to report is an 85-year-old woman from Tavua who died at home on the 22nd of August, and she was not vaccinated. The 10th COVID-19 death to report is an 82-year-old woman from Tavua who died at home on the 23rd of August. She was not vaccinated. And the 11th COVID-19 death to report was an 87-year-old woman also from Tavua who died at home on the 24th of August, and she was not vaccinated. There have been 12 more deaths of COVID-19 positive patients. However, these deaths were classified as non-COVID deaths by their doctors. Their doctors have determined that their deaths were caused by the serious pre-existing medical conditions that they presented with and not COVID-19. With today's newly reported deaths, there have now been 479 deaths due to COVID-19 in Fiji, with 477 of these deaths during the outbreak that started in April this year. As of August the 22nd, the national 7-day rolling average of deaths is 7 per day. The 7-day rolling average of deaths per day in the Central Division is 2, and in the Western Division is 5 per day. Of the 477 deaths recorded during this outbreak, 371, or 77.8%, were not vaccinated. 103 were partially vaccinated, that's 21.6%, and 3, or 0.6%, were fully vaccinated. Therefore, 99.4% of people who have died in Fiji due to COVID-19 were not fully vaccinated. In terms of hospitalizations, we have currently 245 COVID-19 patients admitted to hospital, 108 patients admitted at the Lotoka Hospital, and 26 patients are admitted at the FEMAT Field Hospital, and 111 at the CWM Hospital, St. Giles or McCoy. 21 patients are considered to be in severe condition, and 10 are in critical condition. In terms of testing, a total of 326,851 samples have been tested since this outbreak started in April this year. 1,504 tests have been reported for August the 26th, and our 7-day daily average of testing is 1,692 tests per day, or 1.9 tests per 1,000 population. Weekly testing is at 12.9 tests per 1,000 population, which is above the WHO recommended level of 4 per 1,000 per week, or about 3,500 a week. The national 7-day average daily test positivity is 19.1%, which is on a downward trend, but still indicates a high level of community transmission. So the 7-day average of new cases per day is now at 325 cases per day. As previously announced by the Permanent Secretary, daily case numbers are not currently being used as the sole indicator for monitoring the progress of the outbreak. The Ministry is also closely monitoring other indicators such as test positivity, hospitalizations, and deaths to track the progress of the outbreak. With the decrease in testing numbers recently, testing still remains above the WHO recommended rate of 4 tests per 1,000 per week, or approximately 3,500 samples per week. We will be transitioning into community surveillance testing as severe disease numbers and positivity rates approach the containment phase levels. We are still seeing a high number of cases and high test positivity of about 33.5% in the Western Division, indicating a very high level of community transmission in that division. Test positivity in the Central Division is on a downward trend, but still indicating a very high level of community transmission at around 20.5%. Deaths have also been decreasing in Suvarnasori over the last 4 weeks, while deaths in the Western Division are still at a high level, with deaths per day at a 7-day average in the West now surpassing the Central Division. The outlook for cases found in the North indicates a persistent risk of community outbreak. Further tracing and testing results are needed to clearly understand the level of community transmission, although all contacts of the first case identified in Nambawalu have so far tested negative. And in Namaratiri, Lambasa, so far, all 62 primary contacts have also tested negative. The situation in Kandava and Malolo Island are extremely concerning, as there's clear evidence of community transmission in both those islands, and we expect case numbers in those islands to increase. In terms of severe COVID-19, you hear this message from us very often, and the Permanent Secretary has talked about it already tonight. People with severe COVID-19 are still dying at home or coming to a medical facility in the late stages of their illness. As mentioned by the Permanent Secretary, 78% of COVID-19 deaths during this outbreak occurred at home, on the way to hospital, or within 2 days of admission to hospital, which means that our clinical teams were not given the chance to provide potentially life-saving treatment. Severe COVID-19 is a medical emergency, and any delay in receiving medical treatment reduces your chance of recovering from the disease. You have a higher risk of developing severe COVID-19 if you are over the age of 50, if you have a non-communicable disease or a chronic disease like diabetes, hypertension, heart disease or kidney disease, or if you're obese or pregnant. If you're at high risk of severe disease or have any symptoms of COVID-19, such as cough or runny nose, fever, sore throat, body ache or headaches, please come to your nearest screening clinic to be checked and tested by our medical teams. We also need everyone to know of the severe symptoms of COVID-19, which are difficulty breathing, persistent pain or pressure in the chest, severe headache, new confusion, or pale skin. In Suvarnasori, we have specific health facilities that have been identified to care for COVID-19 cases. These include the Colonial War Memorial Hospital, the FEMAT Hospital at the Vodafone Arena, in Nosori, in the Nosori Health Center, the one in Bokasi Hospital. In the Western Division, please go to your nearest health facility if you develop any symptoms of severe COVID-19. Please call 165 if you're unable to get to a medical facility. In the North, the public are reminded that to continue to practice COVID-safe measures. While all cases are related to the operations at the Nambawalu jetty, the first resided in Nambawalu and the last 3 resided in Namaratiri settlement, which is near the township of Lambasa. The public is still required and asked to practice all COVID-19 safe measures, including wearing a mask when you leave home, washing your hands regularly with soap and water, downloading the Care Fiji contact tracing app, and ensuring a distance of at least 2 meters between yourself and others when you're outside your house. And of course, please get vaccinated. Thank you.
Thank you, PS and Dr. Alicia. Today marks the 134th day of this current outbreak, and this week is the 19th week of this current outbreak. And as we've heard, we've now recorded more than 45,300 cases with more than 470 deaths. Our health services in our various divisions and facilities continue to operate. We continue to undertake surveillance, screening, and contact tracing work in our stationary clinic as well as our mobile clinics. And to date, we've screened a cumulative total of 502,742 individuals in our stationary clinic, as well as swabbed 87,484 individuals. Similarly, in our mobile clinics, we've screened more than 800,000 individuals and swabbed more than 70,000 patients that have presented to these mobile clinics. Our care flow pathway that we have established for the mitigation phases in the Central and the Western Division are working well. We have patients who are positive and are staying at home, risk assessed, and we consider attributes such as age and the presence of comorbidities, and they are placed into categories of high, moderate, or low risk. And the follow-up actions for these patients are tailored to the patient's level of risks. This is all done in all subdivisions in the West and the Central Division. And just as an example, in the West, to date we have recruited 12,898 positive cases who are looked after at home in the 6 subdivisions in the West. Of these, 9,264 have recovered and have been discharged, and there remains 3,545 individuals who are actively followed up by our teams. So if you are a positive patient and at home and you receive a call from one of our team members, please agree to be interviewed. Tell the truth about your symptoms and how you feel, and also make sure that all your issues, doubts, questions that you may have in regards to your ongoing care are answered by our teams. In the meantime, the health facilities in the Central and the Western Divisions remain operational, with Lautoka Hospital as the main COVID hospital in the West, while in the Central Division it's CWM Hospital and the FEMAT Field Hospital providing this role. Patients with chronic diseases, including patients with cancer and mental health illness, should continue to use the toll-free line 165 to access advice and medicines for their illnesses. We are also continuing to use our mobile teams in the Central and the Western Division to access people in the remote areas, including the interior of Tailevu and Naitasiri, again assessing for the disease and carrying out health education and awareness on the COVID-19 disease. As we've heard this evening, in regards the disease outbreak in Kandavu Island, in Malolo, in Naviti, Nasawa, and in Namaratiri settlement in Lambasa, our health team and frontline teams are again responding with planning for these response activities, and will be deployed over the next few days to the affected islands and communities. Once in the communities, their role will be to undertake case identification. They deliver the care that is required. They run awareness sessions in the community, and they support the local medical team to treat other illnesses that are identified in the community. And as an example, and as you heard from PS this evening, for example, for Kandavu, we have a 55-member team that arrived on the island this morning, comprising a health, military, and support services team, and led by a local senior Kandavu surgeon in Dr. Josese Turahava. This team is on the island and will be split into two teams, one based at Vunisea and one based at Kavala. And this evening we have another 27-member contingent team comprising health, police, and support team carrying medical supplies, ambulance, and mobile testing machines to join the team that is in Kandavu now in this response. Similar effort with the same objectives will be staged in the west in Malolo and Naviti, as well as in Lambasa. In the meantime, our health team from the west, who came to support our central division team, have returned to support their colleagues in the west. And over the next, in the coming week, our health team from Lambasa, who came to support the central team, will be returning to support their colleagues in Lambasa. The rest of our health team around the country are again on high alert, given this development in our maritime communities. Our important message this evening is that the latest outbreaks have been linked to breaches in travel restriction, with unauthorized travel that have resulted in the outbreak of diseases in these rural communities. The ministry has put in place protocols to ensure safe travel across borders and between divisions, but unfortunately, there have also been similar reports in the past of travel breaches leading to outbreak of diseases in rural communities. We are again asking the people of Kandavu, Malolo, Naviti, Lambasa, Nambowalu, and indeed the rest of Fiji to follow the travel restrictions that are in place. They are in place for our benefit to stop the spread of disease into areas that don't have the disease. We recognize that some of these restrictions have been in place for a while, but they are necessary, and we need them to stop this pandemic. Please respect and follow these public health measures, and let us work together to stop the spread of this disease in Fiji. Finally, make sure you and the elderly and the vulnerable in your home are vaccinated. And good evening.